Hi everybody, it's Kelly Harrion-Tait again, and I'm going to now talk to you about caring for your foal from birth to weaning. Now, as you would have already heard, a mare's gestation length is 11 months, which gives you plenty of time to organise a suitable birthing plan for your mare, whether that's sending it to stud or foaling at home. It also gives you time to read up and ask questions about what to do with your newborn foal, what's normal, what to be aware of, and when to ask for advice or get a visit from your vet. Foals are brilliant, but they can go downhill quickly if you don't notice some subtle signs. So knowing what a normal foal should be like is the most important thing. And if your foal doesn't appear to be normal, then you need to contact your vet straight away. Today we're going to go through your newborn foal timeline. So this is important to know when your foal should be doing things and what it should be doing when. New foal check, so just going through what a vet check looks for, and that means that if there's, if it's born at 10 p.m. and you're thinking to get the vet out in the next morning, you could have a quick look at some basic signs to see if you think there's any abnormalities and you need a vet sooner. Go through milk and colostrum for your neonate, how much and what quality they should be getting. What to look for signs of prematurity in the foal. Just go through a bit of hygiene for foaling, and then looking after your newborn before moving on to general management of your foal with vaccinations, worming, Farriery, which should be considered from about 2 weeks of age, weaning, and then castration and handling as well. So take you hopefully all the way through to weaning, so 6 months-ish, and castration at 6-9 months or a year. So newborn foal timeline. This is important. You should have a stopwatch in your foaling kit, and you should start it. Don't forget that in the excitement of everything. But gestation length of a horse is really varied. So they're one of the most varied animals, and it's 320 to 360 days. Basically, we estimate it at about 11 months. That's average. Because of the variable nature, this is what makes foaling mares quite difficult, because you can be sat up for potentially 40 days looking for signs that your mare's going to foal, and it's easily missed if you're not prepared, because as much as you can try and predict and look for signs, then they can still pop it out when you're least expecting it. So your mare's given birth to a live foal. It's all gone straightforward, which is brilliant. What next? What should you be looking for? Well, the top right picture is a foal that's just been born. As you can see, it's just come out. It's still attached with its umbilical cord. This is a lovely Suffolk punch foal, and you can see it's just come out. It's still asleep basically. So they come out, and quite often they're a bit immobile for a minute, if that. Then they attempt to right themselves. So they try and get into sternal position. So the foal at the bottom with the white face, he's only a couple of minutes old, and you can see that he's already in sternal. He's got himself righted, he's got his front legs out in front of him, so he's very conscious and aware of his surroundings, and he's trying to get ready. Horses are prey animals. Another reason why grey horses always start off brown of some description, whether it's chestnut bay or basically black. That's to hide in the undergrowth and away from predators, and the horses need to be ready to get going. That's why foals' legs are long as well, so they can keep up with their mother. So they need to be aware and conscious of their surroundings and try and get on their feet quickly. So this is, from 1 minute of age, they should be attempting to right themselves into sternal position. Then at 10 minutes of age, they usually have the suck reflex, and by that, if you slide a finger, clean finger, into their mouth, they should be wanting to actually suck on it, not just chomp. So they might start chomping, but then actually have the sucking action. From 30 minutes, they should be thinking about trying to stand. Now, these first attempts are usually pretty hilarious. So trying to work out how to get their legs moving and coordinated, but they should be wanting to try. And there's no rush to get a foal up to its feet at this point, and watching it get stronger and sort itself out, as long as it's being safe, is absolutely fine. But they should just be working out how to make their legs work. Within an hour, it should be standing. So it should be on all 4 feet, albeit still quite wobbly. but it should be able to stand up on its own and support its weight, and gradually think about taking a few steps. It should be nursing within 2 hours. So that time, that 1 hour window between standing and actually nursing, they're going to be trying to find the udder. It's the natural instinct for the foals to locate that udder between the mare's back legs, but they do start off thinking that every leg could have an udder behind it, and so they start sucking their elbows and potentially the walls behind their back legs and all sorts. They might start following you if you're in there too much. So try and assess the foal and leave them to it initially. But by 2 hours, they should have latched on and had a drink. By 6 hours, meconium must have passed. Meconium is the feces of the foal. It starts off really dark and very hard, and that should be passed within 6 hours. After that, then the foal could be constipated, which is relatively common in newborn foals, and they might need some assistance to pass it. So it's important to note when that's passed, and be aware if you've got a lovely straw bed, then they can sometimes be hiding it. So just have a good look in the box and keep an eye for any signs of droppings down your foal's back end. Urination varies. So for a colt, they normally urinate within 6 hours, and a filly 12 hours. So if your filly's you're not seeing her urinate, in the first 6 hours, then don't panic. But that's the sort of time frame that we're looking at for them. And again, it's important to try to note this. It's easily missed because by 6 hours you might have left them to it for a bit, but it's important to watch them for a period of time and make sure that they are passing urine normally. So that's a basic timeline, and then something else which is quite simple to remember is the 1, 2, 3 system. So this basically just means within 1 hour your foal should be standing, within 2 hours it should be drinking, and by 3 hours your mare's placenta should have passed. If things are taking longer than this, you should consult your vet for advice. So it's simple to remember: 1, 2, 3. If your foal and mare are doing that, then that's a great sign that the foal is conscious and the mare is letting it drink, etc. And if the placenta's passed, it means that everything's functioning from that end as well. So if you've got the 1, 2, 3 okay, then you're pretty good to think that you've got a normal mare and foal. Just another little tip as well. I know Imogen Johns has spoken to you about neonatal resuscitation today, but there is an app called Foal CPR which you can download on your phones, and it has some basic information of what to do if your foal comes out and it's not breathing, and whilst you're waiting for the vet to arrive. So I recommend that you download that app and have it on the phone and read through the notes on there before the foaling happens. So just included these couple of pictures. The mare on the foal on the left was one of the first foalings, well, the first foaling I think I attended as a new graduate, and this mare had some ongoing health issues, and so the lady rang me as soon as she started foaling, and she had a lovely filly foal, and everything was fantastic, and you can see their bonding. It's important not to forget the mare though, because she did actually have a tear from her rectum to her vagina, so she was basically defecating into her uterus. So it is important to not forget her. Then I just included these lovely pictures of this donkey mare, or a Jenny, and her foal, who is actually called Albert. This was a mare, or a Jenny and a foal that I met in Sharjah Equine Hospital at the end of last year. And basically it was just a note to say that donkeys can have longer gestations than equine horses. So be prepared for that. And the other thing is that donkeys are a lot more stoic than a horse. So if your donkey looks dull after she is foaled, but no other signs, please still get her checked quickly by a vet, because she might be hiding something more serious that's going on. But all is well with all of them now. So post-birth parameters. As I said, it's good to have a stopwatch with you, and their respiration rate is obviously their breathing rate, and that should be at 16 respirations per minute. So you can count that by watching their ribs go in and out. It can be quite difficult if they're moving or they're trying to vocalise, but if you're just patient, you can count through that. A heart rate of a newborn foal is quick. It's over 60 beats per minute. So a horse, the adult horse, averages of sort of 32 to 44 beats per minute. So it's a lot quicker than an adult horse. Then you can look at their muscle tone as well. So they should be in sternal recumbency. They should be able to support themselves. They should be able to right themselves into that pose, that posture. The other thing you can check is a nasal reflex. So they cough or sneeze if you stimulate the nostrils with a piece of straw. So that's another thing that you can do just to check its reflexes. If you take these measurements within a minute post-foaling, and if your foal shows any differences, then you can consult your vet immediately. So it is actually post-birth parameters, so as soon as they arrive, these are what they should have. Like I said, they are ready to go, these animals, and they're very aware of their surroundings very quickly. So another good thing to consider is the mare and foal's affinity towards each other. So you want the foal to seek comfort from the mare, and the mare to bond and protect the foal. So this is just a nice video of a foal who is happy starting to explore the world a little bit. I go into the pen and it seeks comfort and goes straight to its mum. That's a great response. That's what you want. You want them to be connected and bonded, and you want them to seek each other at times of discomfort or distress. Not that it's distress, but any signs of worry, you want them to go towards each other. See the foal's on its feet, it knows where it's going. So that's a really normal response. So it's just important, that's an important thing. If they're not really bonded, you start to worry whether there's something up with the foal, worry about milk supply from the mare, and just a little bit about the mare's temperament towards the foal. Younger maidens can display signs which are not so tolerant of the foal. They don't always understand what's happened, and they need closer monitoring than a more experienced brood mare that's seen it and done it all well before. So what does a vet look at with a newborn foal check? So newborn foal checks should be performed within 24 hours of birth. It's very important that that happens. Ideally within sort of 18 hours is good. But basically the following morning after your foal has been born, you should consult the practice and get a vet out, even if you feel that everything is normal. Vets are very experienced at checking newborn foals and will pick up subtle signs which can protect your foal from getting seriously ill or having defects that might stop it from being a riding horse. So what do we look for? So the first thing is that mare-foal interaction, which I just discussed with that video, and you can see here again, mare and foal very relaxed, but mare still just having a protective eye over her foal happily lying next to the mare and seeking some comfort. So that mare-foal interaction, as already said, is important. Then we check the mucous membranes. Apologise, this is actually an adult horse, but we are looking here at the colour of the mucous membranes. You look for signs that they're yellow or spotted as well. So any dark red spots or purple membranes, you just want them to be a degree of pink but not too dark, and moist. And if you press your finger in and it blanches, then that colour should return within 2 seconds. So that's what we're looking at there. The other thing that we check is the cleft palate. So we just make sure there's no defect in the roof of the mouth. Another thing to look out for, which could indicate that, is milk coming down their nostrils. So if every time your foal drinks, then it starts streaming out of the nostrils, that signifies there might be a connection between the mouth and the nares, and it's just draining out there. It's very important, one, because it is not potentially getting everything that it should be getting, and 2, because if it's going up to the nostrils, then they could be inhaling it, and that can cause aspiration pneumonia and a bad respiratory infection. So we check for that and we look for that, and at the same time, because you run a finger up through their mouth when you're checking for the cleft palate, you can also be aware of their suck reflex and make sure that's functioning. The next thing we check is their chest. What we do is palpate their ribs, looking for any fractures. Rib fractures are relatively common. Especially if there's a traumatic foaling, as you can imagine, pulling the foal out through the narrow birth canal can cause a massive squeeze, crack fracture on the foal. So we check for that, because if there's a rib fracture, especially towards the front of the chest, then it can be dangerous and could potentially puncture the heart or the lungs. So it is something definitely that we check for. Again, we check the respiratory rate and the heart rate, as we've already mentioned before. And we also just have a listen for any heart murmurs. These are often present at birth because there's a hole between the heart chambers, which causes a swooshing sound as it backflows. This does close shortly after birth, so that's usually within 24 to 48 hours of birth. If there is a heart murmur, then what I do recommend is that if you have your mare checked on foal heat, which is about 7 to 10 days after foaling, that you just get the vet to recheck that then. And usually they're fine, which is a bit of reassurance that your foal's heart is absolutely fine. We then move down to the abdomen. It should be relaxed. It shouldn't be distended or pot-bellied. And we have a look at the umbilicus and make sure that they're urinating via the urethra and not the umbilicus. So sometimes in colts, it's easy to confuse the two. You think from afar, oh yeah, they're urinating, brilliant, but it's very important to ensure they are urinating through their penis and not their umbilicus. So they're urinating through their umbilicus, then it can signify that the urachus is still patent. If they've got distended abdomen, it can also signify potential meconium impaction, or it can mean there's a ruptured bladder, which can be a result of a traumatic foaling. So it's just things to be aware of. Sometimes the foals, or often the foals, can look pretty normal, but they have one of these things going on inside. So they're important things to check. The other thing when we're checking the umbilicus, we make sure that it's not fat, sore, swollen, any pus material oozing from it, not bleeding. And the other thing is we check that there's not a hernia there. So there's a hernia, then that's where the body wall hasn't quite closed up where the umbilicus is, and that means some of the intestines can fall through that hole. That in itself isn't a problem, but if the hole's tight and the intestines get stuck, it can cut the blood supply off to the intestines, which can cause a serious surgical colic. So checking for a hernia is important. So then we move on to check the limbs. Often I get them to be moved onto a hard, solid surface, because then I can examine the full limb, and especially the distal limb, which would be hidden in the straw if it was still in its stable. I might not necessarily see them at walk at day one, but it just means that I'm aware of any problems that I might be worried about, and I might see it have a walk the next day. You can see this foal on the left has got a ballerina type posture, and that is due to contraction of its flexor tendons pulling that toe and that pedal bone round so that it's up on its toes. Now we can treat that if we look at it early on, just with injecting it with some oxytetracycline, which causes the calcium channels to relax, and those flexor tendons can then relax and become slack. We can also put on splints and bandages, and they often respond very quickly to this. So yeah, so it's important that you do get them thoroughly checked at the beginning, and if you notice anything in the first couple of days after it's born, then do send a picture or ring your vet. This one on the right has got a bit of a windswept type left hind, and again this did really well with just massive bandages just to force that joint through the fetlock straight, and it went on to go into training as a racehorse. So even if they look pretty bad at birth, then it's important to seek advice and treatment, but not to panic, because we can do quite a few things for these young foals. So the vet that should then give a tetanus antitoxin. All broodmares should be vaccinated for tetanus, and vaccinations of the mare in the month up to the foaling provide some cover in the colostrum as well. So if you're conscious of tetanus, then getting your mares boosted with tetanus vaccine a month before foaling is a brilliant idea, and then the foal will ingest some of this antibody through the milk. We do always, because we're not sure how much it's received, give them a tetanus antitoxin in the first few hours of birth. So when we do the Foal Check, then we do give an antitoxin to tetanus. Again, it's umbilicus is open to the outside environment, which is where tetanus lives, so it's very vulnerable to getting tetanus, and important that it receives the cover. An enema might also be required if it's struggling to pass the meconium. As I said, meconium should be passed within 6 hours. If a foal is mildly colicking and you haven't seen evidence of that, then an enema would be warranted. And then we've got to think about the mare. She's done all the hard work, and we can't forget about your trusted brood mare, who's hopefully delivered a healthy foal. So there's a placenta to consider. So please keep that for the vet to check. Even if you've seen 100 placentas before, we do like to have a look at them. If your mare's placenta is retained and just part of it's protruding, but she doesn't seem to be passing it anymore, do not pull on it. If you tear it off and this half of it remains inside, it can be a lot more difficult to remove. So you can tie it up so it's off the floor, so it's not dragging around in the straw getting stood on. So just use a bit of blade and twine and try and tie it up. It's quite slippery, so it can be difficult. And give the vet a call, as said before, if it's not passed within 3 hours of birth. And try to keep it away from foxes as well. So ideally, if it's protruding, you tie it up and monitor her, and then call the vet at 3 hours. If she's managed to pass it, put it in a bucket with a lid or a thick plastic bag and tie it up, and wait, for the vet to have a look at it when they check the foal the next day. If you look at it and think, oh, there's a massive, there'll be one tear in the placenta, which is where the foal's emerged from. If there's other tears, or it looks very ragged, then that's a sign that there could be some placenta still left in her. So again, they can become toxic from placenta retention, so it's important that you consult the vet, and they might come out to treat that and just check that it is all out. The other things we want to check the mare is we look at her vulva, make sure that her vulva is not too badly damaged. There will obviously be some bruising, but if it's torn or shredded, then we just keep an eye on that. She might have to go onto some butane antibiotics so that area stays clean and doesn't become infected. We look at her udder, make sure she's got a good milk supply, hasn't got a hard, hot udder or any signs of mastitis. And then we check for vulval discharge and general demeanour. I also usually check her mucous membranes, and if I've got any concerns, I'll take her heart rate as well. I find heart rates can be a bit misleading because quite often the mare's a little bit irate because we're in with her and her foal, so I don't want to be interfering in there for too long. But if I've got any problems, I will definitely take its heart rate and temperature as well. So your mare's foaled, and the foal is standing up, and the next thing is that it needs to find a food supply. So ideally within the first 2 hours that foal should be on suck. You can just make out from here these shiny teats, and that is a great indication that the foal has latched on and found that udder and sucked it clean basically. So neonates have a very low percentage of body fat, so energy reserves are low, which is why it's so important that they drink at this young age. They stop absorbing maternal bodies and colostrum from 12 years old, so even if they've got good colostrum still in the udder, however much they drink after 18 hours old, they are not going to absorb any. The proteins of the colostrum are huge, so the IgG, we call them, antibody proteins, are huge, and when foals are born, the lining of the gut has got lots of gaps in it. From 12 to 18 hours of age, these gaps start to close. This is clever because the body doesn't want them to start eating feces, licking the walls and doing all the things that foals do to investigate their surroundings, ingest lots of bacteria which can then pass through the gut into the bloodstream. So these gaps start closing to try and reduce that, but obviously it also means that their gaps are too small to absorb the antibodies. So from 12 hours old, these gaps start to close, so it's very important that the foal receives colostrum in these first few hours of life. So most foals start searching for that udder as soon as they stand. Some foals who are a bit of slow starters find that more difficult than others. And if the foal is struggling, the first thing is the mare still? one thing is if there's lots of people around the mare and foal, then they are going to become stressed, and maybe the mare will not be settled and she'll move around a lot. So hold the mare still, see how the foal gets on with the mare stood still. If she's still very fractious, then a light sedation might be necessary for the mare, just to get them settled and start the journey together. So a little bit of sedaline, or the vet coming out to give them a little bit of sedation, can be recommended. And then to help the foal find the udder, if holding it still isn't enough, holding the mare still isn't enough, you need to kind of attract his mouth towards it, but not push by behind. If you push it by behind, it's kind of forcing it and it doesn't get it and it just wants to move in a different position, so you're trying to make it go. So actually taking your fingers underneath the mare's udder area and standing on the other side and sort of attracting the foal's attention towards that area is the best way. Sometimes as well you can get it sort of sucking from your finger and then sort of latch the teeth into it. Patience is important. It is frustrating, but usually if you bear with it, they will latch on, and it's brilliant when they get it. And once they've found the teat and had a good drink, then usually that's them away. Maiden mares are less tolerant of allowing a foal to suck. They might squeal, lift a leg, swish their tail. Just monitor that, because some maidens are very touchy about that area. It's quite good if you have a maiden mare, just in the couple of weeks before foaling, get them used to having that udder touched by you. Obviously be careful you don't get kicked, but just palpate that area once a day. It's a good way to be checking the udder, which is a good sign of foaling anyway. And just get them used to having that area prodded and headbutted and whatever else, because foals can actually be quite brutal on it too. Call the vet for advice or a visit if the foal is not on suck within 2.5 hours. We do really want them to be drinking, so it's important that we're notified if the foal isn't. So then colostrum. Colostrum quality is important. If your mare has been running milk before the foal was born, it's likely that all the colostrum has already leaked out and all she's got left is just normal milk. So if she has been running milk, then it's important that you let the vet know and try and get some colostrum in your freezer ready to administer to the foal. So to test the colostrum quality, you can use a sugar refractometer. They're available through us and they're very easy to use. You just put a drop of milk, so just milk a tiny bit, onto the end of the refractometer here. Then you place the glass slide on top, just flip it down, and then you hold and look through this bit here, through the eyepiece, you hold it up to the light. A line then comes across on the marked ruler that's on the screen, and it says how much sugar basically is within the colostrum, and that is an indication of its quality. So 20 to 30% sugar is adequate quality, and above 30% is excellent quality. So it's a good way to check your colostrum if your mare has been running milk as well and you're a bit worried about it anyway. The volume of colostrum. Foals nurse really regularly, approximately every 10 minutes. So they need 1 to 2 litres of colostrum in the first 18 hours of life. So that's quite a big amount for a newborn small horse. They consume around 15% of the body weight in the first 24 hours. And this increases to 25% in the first few days of age, which is 15 litres of milk per day, which is a huge amount. So your mare is doing a great job producing that milk. You should ideally have some good quality frozen colostrum in your freezer. Be prepared. You don't know what your mare and foal are going to do. So having that in your freezer is massive, and it can save a vet's bill of having to have plasma at a later date. If you can have at least 500 ml to 1 litre in your freezer, then you can either bottle feed or the vet will administer via stomach tube, and that can save you having to have an IV drip of plasma later on. So try and be prepared and find some colostrum from a local stud who's willing to sell or let you have some. The best time to try and get this as well is at the end of the previous season. So if your mare's in foal, start phoning studs at the August, September of the year that she got in foal, and they'll probably let you have a bottle, and you can keep it there safely until your foal is ready. So if you do need to give your foal some extra colostrum, there's a couple of ways that can be done. The first is by bottle feeding. Please take care when bottle feeding your foal. It must have a suck reflex. If it doesn't have a suck reflex, it will not be able to feed through the bottle. If it's not actively sucking that milk in, then the milk will end up down its airways and it will get pneumonia. Keep the bottle level. That way even gravity is not forcing that milk into the foal's mouth when the foal isn't ready to swallow it. Don't squeeze a bottle, same principle, you just hold it gently at a horizontal level. A newborn foal shouldn't have more than 300 millilitres of colostrum at a time. For all of these values is when I'm talking for your average 50 kilogram foal. So if you've got a small pony foal, then I would take that down to 200 millilitres. If you're unsure, please call the vet. It may be better to stomach tube the foal, administer it safely, make sure it has a full belly. The other point to make as well is that when defrosting the colostrum, you should put it in a lukewarm bottle of water. If you heat it at too high a temperature, what that does is it denatures, so damages those good antibodies that are in the colostrum, which is what you want the foal to be getting, and it makes it all pretty pointless. So you want it just at a bath temperature water, and you just leave it in like you would defrost some milk. And ideally you let it warm up so that it's not cold when it hits your foal's stomach. This will also encourage it to take the milk from the bottle. So how do we know that the foal's got enough antibodies from the colostrum, so i.e. consumed enough colostrum? Well, to do that we need to do a blood test. So you can do it from 12 hours old, but it's most accurate from 18 hours old. If you think back to when those gut boundaries start closing over, then we need to wait for those to close, because otherwise it could still be intaking more antibodies and we could get a false low result. Often, if a foal's born at midnight and we go out to check it at 8 AM, it's only 8 hours old. This is still important, as I said, to check for any abnormalities, make sure it's got its tetanus on board. And then depending on what our thoughts were, if we're happy with that foal, we'll probably just pop back the next morning and take a blood sample for the antibody levels. If we've got any causes of concern, we'll probably want to check that foal later on in the day anyway, and we'll probably take a blood then. So if you take a blood at sort of 6 PM, then that's going to be about 18 hours old, and we could get a result that day and make sure it's got enough on board. You can either do a snap test, which is shown in this picture here, and that acts a bit like a diffusion test, where you drop a piece of blood onto the hole and it diffuses across in a set time, and then lines come up, a bit like a pregnancy test, and it's a control line and a line to suggest that the antibodies are at a suitable level. More accurate results can be obtained by sending them away, and they run different tests in a laboratory. So it depends on whether it's a weekend, because then it's hard to get the bloods to the laboratory, and also how urgent it is, because if you send them away, we're not going to get the results the next day. So if there's any concerns, we generally do a stall side test. If the antibodies are low, you can give antibodies into the vein via a drip, and this is called plasma, so it's hyperimmune plasma. This is really rich in antibodies, and putting it straight into the bloodstream means that the gut doesn't have to be open to absorb the proteins across, so it can be done at any point in a foal's life. Ideally though, if they are low, you want to get them in the foal quick so that it has immunity against infectious diseases, sepsis and other causes of ill thrift in a foal. If a normal reading for the antibodies is above 8, if it's below that, then you probably are looking at giving it some plasma. And 1 bag of plasma, so 1 litre, will raise the reading by about 2. So if your foal has got an IgG of only 2 to start off with, then you're probably going to need more than 1 bag of plasma. We have to be careful how much fluid we give to a foal at once, because if they give them too much into the bloodstream at once, it can cause them to have some pulmonary edema, so some fluid on the lungs. So depending on the foal size, I'd recommend that they have only 2 litres maximum at one time. This then gives us an opportunity to re-bleed and see what the levels are, and if they're still low, we can give them another litre at a later time. It is essential that this gets done if the IgG levels are low. As I've already said, it does give them a much better immunity, reduces the risk of hospitalisation. It is, however, relatively expensive, so it's much better to get that colostrum in your freezer and have it ready to be tube fed or bottle fed to your foal, and that can save you a lot of time, money and effort later on. So prematurity, it's essential to know the foaling dates that you're expecting. You might think this is obvious, but there's a lot of people out there who are confused about when their foal's due. Most studs should give you a foaling date when you go and pick your mare up. So if your mare's gone to stud to be covered, then you should come home with a card with a foaling date on it. If your mare's being inseminated at home, get your vet to give you a card with the expected foaling date on it so it is clear. Before 320 days, if your foal arrives before then, it's considered as premature. This can lead to problems. Ossification of the cuboidal bones, which are the bones in your horse's carpus and hocks, only occurs in the last few days of gestation. If they arrive prematurely, then we recommend that hocks and carpuses are x-rayed to check that ossification has occurred. This is an x-ray which shows that ossification is not complete. And this was a foal that was 3 weeks early, and that requires a lot of intensive management if you're going to have a chance of having a riding horse or even a sound field horse. So it is something to be considered seriously, and very important to check from an early age rather than wait till the foal gets bigger. Other signs of a premature foal are a domed forehead and a silky coat. I apologise for this photo. This is actually a gorgeous showing Arab, and this foal was full term, and it is a beautiful foal, but it does have a domed forehead, which is typical of the Arab breed. And it was just a picture that I had and thought it would help you remember one of the signs. So if your foal exhibits any of these problems or signs, then again, call the vet. So when foaling, I know Anna has spoken to you about foaling the mare, but I just think it's good to reiterate some important things. And that hygiene management will be essential for the health of your foal. So if your foal was born in a really dirty environment and it ingests faeces, it's got no immunity yet, it's not had a drink, its umbilicus is open to the environment, and bloodstream is going to absorb any bacteria and fecal material that are present, that's going to give it a really poor start and can cause a lot of struggling. So you want to reduce that as much as you can. So ideally, when your mare's starting to look like she's thinking of foaling, to entering stage 1, you want to apply a tail bandage just to keep the tail out the way and to make sure it's clean. Clean your mare's legs, and it's always very exciting, but actually you have got a bit of time in stage 1 of labour. So clean the mare's legs, tail and udder with warm soapy water before she foals if possible, and then repeat this straight after she's foaled as well. When that foal is looking for that udder, like as I said already, they don't naturally necessarily go straight to it, so they do start sucking other areas of the mare, and if these are dirty, then they're going to start ingesting that. So clean the front legs as well. Remove wet, dirty bedding from the stable regularly, and as soon as they fold, try and get rid of all the afterbirth and any liquid that's been expelled, or top up with clean straw. And straw is preferable for foaling. It's more absorbent, it's warmer, it's more comfort, and it also provides a better cushion for that foal. So cleanliness is key to preventing the disease. Other things that you should have ready for looking after your newborn foal is nasal spray, and this is to spray the umbilical stump regularly, about 4 times a day if possible, from birth until about 3 days old. The umbilicus should close up within about 48 hours, and during that time you need to keep it immaculately clean and covered with an antibacterial agent. We make this spray and it's much better than iodine. Iodine has been shown to be pretty much as effective as using water when swabbing umbilicuses after using iodine. So we don't recommend iodine, but definitely our nasal spray, or if not, then mix some chlorhexidine, which is Hibby scrub, with some surgical spirit, and that again will be preferable to iodine. The stump should be shriveled and dry within 48 hours. You could have an enema ready as well and administer that if needed. As I said, the meconium should be passed within 6 hours. Ideally consult your vet first, but it's good to have one to hand, because if it's just mild and it's not mildly colicking and it's not past its meconium, we might advise that you give one of those first, depending on the situation. No more than 2 enemas should be given within a 24-hour period. So if you did have an enema to hand that you've administered, and then you call the vet out, please let us know that you've already given them 1 enema, as we don't want to over-enema them. They contain phosphate that can actually be absorbed through the rectum into the foal's bloodstream and can upset its electrolyte levels. So only 1 enema should be used initially, with maybe 1 more further in the 24-hour period. What you do is you feed the nozzle into the rectum and squeeze until the entire bottle is in the rectum at once. Try and do it quickly, try and keep the foal relatively still, and then monitor it, but try not to interfere too much. The foal should pass the hard nuggets of meconium after application. Don't interfere too much with the foal. The mare needs to look after the foal, and the foal needs to start looking after itself. By interfering too much, you can disrupt that delicate balance in relationships. So try not to be interfering with the mare and foal as much as you're delighted to have it too much initially. The other thing is to keep your foal warm. This was a foal that hadn't actually had enough milk, and it was underweight, and it actually just got quite cold, so we had to go out and give it a drip and also warm it up. I can successfully say that it's doing really well now, and I think it's 2 years old this year. But as you can see, we put stable bandages on it. Their extremities, so their legs, ears and ears, are where they can lose a lot of heat. It's furthest away from their central core, and by feeling those you can just get an idea of how its circulation is doing as well. So if it's ever got cold, freezing cold legs and looks a bit quiet, then consult your vet, because that can be a bad sign. The other thing is to have some active warming. So on this foal we improvised and used some hot water bottles, and as you can imagine that made it nice and cosy and helped increase it. So you can also use heat lamps if they're available. Passive cooling is great, so stable bandages, rugs, all of that, but actually sometimes you do need some active warming as well to get it started. If you notice any of these signs on your foal, it is vital to call the vet. Lameness of your foal can be difficult to assess. They're wobbly, they're all over the place, they're inquisitive. It might be a bit intermittent, so it might trot across the field sound and then take some lame steps, and then vice versa. If it is lame, it's important that you give the vet a call and we have a chat. They are susceptible to things like joint ill or septic joints, which can be from septicemia, so infection through their umbilicuses, and they can have other problems such as that poor ossification of the cuboidal bones, and they're a bit premature. So it's important to take seriously. Swollen, wet or painful umbilici, such as in this picture here, again we want to make sure that the umbilicus isn't leaking with urine, that it's closed. Want to make sure there's no infection, no abscess at that point. It communicates so closely with the foal's blood supply that if there is infection getting in there, then it puts your foal at risk of septicemia. The other thing is umbilical hernia, as I've mentioned earlier, and you can just place a little lambing band, and by that I mean a vet, place a lambing band across that skin to cause it to be tight, keep the intestines in, and then the body wall will heal. It's important that a vet does this, because if you trap some intestine in that band, then it can cause a very deleterious effect. Nasal discharge, so snot, they shouldn't be snotty at a young age. Milk, as already discussed, sign of a cleft palate, can be aspiration pneumonia. Distended abdomen, again, ruptured bladder, impaction. Also hypomotility, so if your foal's a bit of a slow starter, then their gut might slow down, and then that can sometimes cause them to have a distended abdomen. Colic signs, no feces pass, we've touched on those things already. Yellow membranes, some foals are allergic to their mare's milk, and this causes them to become anemic and for them to become jaundiced. Abnormal behaviour, so not following that 1 hour stand, 2 hour on suck pattern, not having a strong affinity with the mare, being a bit vacant, maybe walking into walls, licking walls, all of that can suggest that they're what we call a dummy foal, which is where the foal maybe was a little bit starved of oxygen during the birthing process, and it will recover, but it's important that these foals are supported as they're higher risk foals. The other thing is to check the eyes, the sclera of the eye for any trauma, to make sure they're not reddened, and also that the eyelids don't invert. So sometimes foals are born and it's got an entropium, and the eyelid rolls in on itself, and then the eyelashes scratch the eyes, and it can cause an ulcer. So just making sure the eyelashes on top and bottom of both eyes are facing outward, and that both eyes look the same. This can sometimes occur after birth, so in the first few days of life, and so it might be after the vet's even checked it. So just keep an eye on those as well. Foal heat diarrhoea. This is one of my favourite photographs of a foal that had diarrhoea, and it was absolutely fine. And it cleared up quickly, but it's called this, foal heat diarrhoea is called this because it occurs at 7 to 14 days after foaling, which is when the mares are entering their first season, so i.e. foal heat. It's not caused, as commonly thought, by changes in the mare's milk. It just coincides that this is a time that changes are happening in the gut physiology of the foal as it matures. And these changes can disrupt the natural flora of the gut, and the way it processes food is probably taking on some bits of its mum's feed and some forage, and all those changes can cause it to have what looks like an upset tummy. Always call the vet if your foal has diarrhoea for some advice. If the foal is on suck and has a normal temperature and is behaving perfectly normal, then it is usually very widely accepted that it's just a bit of a change of gut physiology and the foal will recover. The problem is, even if it is a normal temperature and still on suck, that sometimes, if it's a really hot period of the year, they can still become dehydrated, so it's still worth checking. Sometimes they might need some gastroprotectant or a bit of probiotic type biosponge, which helps absorb and solidify the feces, and that's very easy for you guys to administer via a syringe orally, and they usually take it quite well. So there's things we can do if it's grumbling on for a few days. So worming. Imogen's done a talk for you guys on worming, but I just wanted to reiterate how essential it is. These are some large ascarid worms that have come out of foals, and they're not very nice, and they can cause problems. And as Imogen would have already discussed, you do need to worm your foal more regularly than your adult horse. So they're prone to worm burdens. They live in quite often large groups. Quite often they're mixing mares from different backgrounds and different yards because they're all coming to foal down at the same place. So you need regular worming, and you need to be able to monitor this, make sure the foals look well. How to handle a foal. So this is just me here with a young thoroughbred foal. And as you can see, he's not got a foal slip on yet. He's only a day or two old. I'm just doing its new, looks like actually I'm just doing its new Foal Check, so it's be less than a day old. They don't understand, horses aren't born, as I'm sure you're aware, knowing how to lead. So don't put on a foal slip and expect it just to walk off a lead rope. It won't. Putting on a foal slip is actually absolutely fine to get it used to it. If you're going to turn them out or keep it on, then please use a leather one, as they snap easily if they get caught. And also please regularly check it for rubs and make sure it's not getting too tight. So ones with buckles to expand it regularly are important, otherwise they can cause nasty sores. So instead of pulling from the front, you really want to push from behind. So as you can see there, my left arm is around its bottom and my right hand is over its chest. Keep it close to yourself as well. So if you keep it close to your body, there's two things. One, if it lets out a little buck, then it's not going to kick you. Two is you can use your body weight to push it along. Keeps it more secure. Try to familiarise them with being handled from a young age. So after the first couple of days of letting it be with mum and backing off, you do want to do a little bit of handling with it just for 10 minutes every day, just so it gets used to humans, used to being touched. Pick up its feet and also reassure the mare. If you need someone to be with you to handle the mare at the same time, that's important, especially, like I said before, for a maiden mare. Again, I'm expecting there to be another talk on farriery with your foals, but just to reiterate how essential this is. This foal here, for example, again another ballerina foal, but on both front legs with contracted flexor tendons, did come right with bandaging and splints and lots of farriery, lowering those heels to try and encourage those flexor tendons to stretch out. And we usually start that anywhere from 10 to 14 days of age. So it's important that a good farrier who knows how to handle youngsters and how to treat them is used for these new young foals. If in doubt as well, restrict the foal's exercise. So if you're thinking, well, I'm not quite sure about those legs, the vet's coming out in 4 days anyway to do some vaccinations or whatever, so I'm just going to wait till then please just don't turn it out in a massive field all day, because this will make it worse. If you've got a small pen or paddock so it can have an hour or two exercise a day, great. But if you haven't got that option, then please just keep it in and maybe take it out once a day to let it run around an arena or something like that for some exercise. Also, send pictures to your vet and get some advice, because they might think it more urgent than you would believe. Then vaccinations. We don't start vaccinations until they're 6 months of age. I think there's one flu vaccine that is licensed to use from 5 months. But basically, if you use it too early, then the vaccine works against the maternal immunity provided by the colostrum from the vaccinated mare. And what we get is a reaction against the vaccine, so it actually has a negative effect. So starting them from 6 months old is absolutely fine. 3 things that we routinely vaccinate against. One's influenza, so equine flu. There's tetanus, we can start actually vaccinating for tetanus. And then some, but not all, will do equine herpes virus. This is becoming, there are outbreaks of herpes slightly more regularly. And it will offer some immunity against these outbreaks. So worth considering, especially if you're keeping your mare and foal on a big competition yard with horses coming and going and travelling a lot. So weaning. So this is lovely Betty with her mare Waffle as a foal, and then this is him a year later with his best mate Pancake. So he was a great foal through his weaning process, and it was done very well. And you typically wean from about 6 months old, but can be done anywhere from 3 months onwards. So it depends on lots of things when you wean, and what's best for you and your mare and foal really varies, but anything from 3 months onwards is absolutely fine, as long as the foal is fit and well. Most foals start self-weaning. They start going off to explore around the fields, around the paddock. The mare barely lifts her head up. They're sort of done with each other at some point, and it just becomes a milk bar more than anything else. Quite often the foal starts to get more feisty and stronger, tries to play with its mum. Often the mum's not so interested. So they do start self-weaning. What's quite handy is if you can buddy up with a similar age friend before the weaning. If they're introduced to new horses before weaning and they become bonded or familiar with those, then weaning will be a lot less stressful. Introducing a lot of foals, even of similar age, that don't know each other when weaning can actually be more stressful than just separating the mare and foal on their own. So having a slight bond with their friends before they all just live together without their mums is useful. It's very impractical in lots of places, but if you can do it gradually, i.e. separate the mares and foals, but they can still see each other, and then take them further away and bits and bobs like that, it can lower the stress that the foal endures and the mare endures. So something to consider it if it's an option. Introducing creep feeds, so a bit of foal mix before the weaning, is good, so they can become familiar with feed stuffs. They're going to lose their milk supply, which at this point, to be honest, isn't enough energy for them anyway. So by introducing them to the creep feed whilst they're still with their mums, again, it reduces the stress and also prepares their gut for the new feed source. So if you are weaning early, which can be indicated if the foal is growing too well, if the mare's doing really well, producing a lot of milk and it's getting too big and strong, we're worried about it growing too quickly, you might consider weaning too early. The mare's not doing well, so an older mare, sometimes lactation, and especially if she's back in foal again, you might consider weaning the foal off so that she can have a chance to keep some energy for herself. And the other thing is practical reasons. So if you have a late foal, say if the foal is born in July, but you want to wean several together that have been out in the field all together at the same time, and they've been born in April, then you might be thinking of weaning at October, for example, when the foal is only 3 months. As I said before, then that is fine as long as the foal is doing well. Milk doesn't provide enough energy for a 4-month-old foal anyway, so it will start to forage, start to eat its mare's feed, and it will be looking for some creep feed if you're providing it. Approximate estimate of how much it needs is 0.45 kilograms per month of age, but look at the feeds suppliers' recommendations and follow those. It's always worth consulting a nutritionist if you have any concerns about your mare and foal. Don't forget the mare in this. She will probably find it a bit stressful as you're separating her from her baby. They usually get over it very quickly. Like I said, the foal, as it starts to get boisterous, most mares start to find them slightly irritating. So it's not usually too much of a problem. Again, try and buddy her up with a friend and wean them separately as well. Check the udder daily after weaning. Make sure there's no signs of mastitis, any discharge, swollen udder, heat, hardness, hind limb lameness as well. That can be a common occurrence where they look lame on one leg. What they're actually doing is swinging their leg wide so that they're not brushing the udder as they take a stride underneath them. Make sure she's not dull or lethargic, not got a temperature. Don't milk her though, so unless she has definitely got mastitis and is showing signs of that and the vet's checked her and told you to, don't milk that udder. By milking that udder after she's been weaned, it will mean that you're keeping that milk supply going, encouraging milk letdown, and she won't dry up. The final thing to consider is castration. Why, when, where? So typically castration is performed at 6 months to a year old. Ideally you allow them time to get over stress of weaning first, but if less than 2 years old, can usually be done at home if there's a suitable environment for it to be performed safely. Usual time frame for doing it is spring of the following year that they're born. So say they're born in May, they might be weaned in October, and then in April of the following year we'd be looking to castrate it. This is before it gets too hot with lots of flies, but hopefully when it's become drier so it's not really muddy. It also gives them several months to get over the stress of weaning and adapting to new food sources. Older or very big horses and all donkeys should be done in a hospital environment. As horses get older and bigger, and also with donkeys, their blood vessels are a lot bigger and there's more chance of complications. This means that it should be done with a closed procedure. When doing it with a closed procedure, you have to use suture material. And if this isn't done in a sterile environment, it can lead to infection. So if they're older or big, or they're a donkey, we do generally recommend that they're done in a hospital or a clinic. Obviously check that they have 2 testicles before knocking it out or going any further. And we do recommend castrating unless you're definitely going to keep it as a commercial stallion. Stallions have to often live on their own, and they can become very opinionated, and if not handled, or if you've not got the facilities to handle them and keep them separate from there to avoid accidents, then it's definitely easier to have a gelding. It can be done standing under sedation only, but it is usually done under general anaesthetic. Even if it's a good, well-behaved, well-handled weanling or yearling, often it's just a lot easier to knock them out. It's still quick, it means you can really visualise what you're doing. You're not worried about the foal kicking and they're not sucking up the testicle. You can ensure you've got the whole structures out. What you don't want to be left with is a rig or an infection because we've had to rummage around. So actually rolling them over, it is often the safest and gold standard way to do it. Also, they're very, very small, like this little foal here called Boo. Called Boo because the owner bought the mare in foal in September, but she didn't realise it was in foal. She bought it in September, and one spring day she rang me and said there was a foal in its stable, and that was Peekaboo. So little Peekaboo I definitely knocked out and rolled over because there was no way I was going to fit underneath his back legs to perform. And that's it. So it's very exciting to be breeding a foal, and you'll hopefully get a lot of pleasure and have a great foal that will turn into the riding horse and animal that you planned. If you've got any questions, please give us a call and we'll be happy to help. Thank you very much.